it's hard to imagine that someone who's pregnant could use drugs. We think it's impossible, but it happens. And why? Let's find out. And better yet, what can we do about it? Program manager at Black Creek Community Health Center, Audrey Taylor, is here, and the director of Outreach Services, Sonali Sagare, is here as well to talk about this very important issue. Now, maybe, Audrey, you could give us an overview of what the Black Creek Community Health Center, or the BCCHC, is all about.
The Black Creek Community Health Center is a non-profit-based community health organization. It's funded by the Central Link and the Ministry of Long-Term Care. So we have focused on 5 service areas, which is primary health care, health promotion, illness prevention, community capacity building, and service integration. So with that, we actually collaborate with Jane Tweed on the program for which we call Bridges to Moms, around substance use in pregnant and parenting moms.
That's right. And so, Sonali, maybe you could tell us what the Jane Tweed Centre is all about.
So the Jane Tweed Centre is a center specific to women who are having some struggles or issues or challenges with substance use, along with the mental health and/or problem gambling. So we have a range of variety of services at the center. The center has been in existence over 25 years by now. And we have different programming starting from support and stabilization up to the continuing care. However, I think I'm just going to focus more about the outreach services model here today because it is geared specific to the pregnant and parenting woman and the children.
A woman who's pregnant and is using drugs, on the surface, I mean, you think, why is this person doing it? Crazy. But there's probably a long backstory that has led to this moment, right? What leads a woman to be making such dangerous choices?
Sure.
There are many psychosocial issues that leads to that decision. But the underlying fact, there's also some experience. Most of those women have experienced some traumatic events in their lives. So often the decision to use is often what we look at as a coping mechanism to deal with some of those issues that is affecting that particularly kind of issue that they're having. It's already difficult for a pregnant mother to just think about harming that child. There's a lot of stigma with that. And so the difficulty are so numerous. And there's the issue of, might be the issue of sexual abuse, intimate partners abuse, sexual violence. There are a number of psychosocial issues that can cause such a behavior.
And unfortunately, when a woman makes that choice, she then brings another human being into her tragic story. Yes. And the fetus, we know about the dangers of alcohol. And tell us about some of the other effects that drug abuse could have.
Again, I mean, as Audrey mentioned earlier, during my career at the Jane Tweed Center, I haven't seen any single mother or a woman who really does not love her child. So when we talk about the fetus and the impact on the fetus, it's not the choice that she really wants to make at the time in her life. It's the history, the traumatic events that she's been gone through. It's the support network that she is around with probably is not supporting her in the best possible way that she could get that help throughout this process. So I think it's the impact on the fetus is not necessarily only because of that substance use. We really have to see as the determinants of health complex into this, right? How it impacts on that woman. So it's definitely fetal alcohol spectrum disorder is a big issue right now during the community, and we are trying to address that by providing the education and knowledge to all these women who are accessing some kind of support through our programming. At the same time, when we work with these women, we do assertive outreach. We work in collaboration with other partner agencies and help and support these women during their safety. Basically, safety is a major piece for them. We try to provide them all the support network around that because, again, like when we are impacting that when the women are making the choices to use during that time, is not because they really want to. It's because of the other factors around that.
That's right. So do we know what works to help these women?
Absolutely. I mean, again, we can go on and on what works. Modified treatment programming definitely works. Mandatory treatment does not work. So when we are saying the collaboration works, we outreach services definitely works, because we are not going to wait until these women come and see the support that they need to. We want to go out and meet them in the community wherever they are at. We meet them at the coffee shops, at the malls, wherever they feel comfortable with, because as we know, the stigma surrounded with this, especially with pregnant and parenting mom, and the barriers to the services. How many services are there which are geared to the needs of this pregnant and parenting woman? So I think that is the main thing that we really have to consider.
You go where
We
they
go where
are.
they are, yes. We go where these women are. We meet them where they are, whether they want to come into the office, and we go out to their houses, we meet them wherever they're comfortable to meet us, because it can be very difficult considering the stigma that surrounds the issue for them to come in and seek help. Also, for us, for most women, the biggest fear is also the issue of care, their kid being taken away into care. So that's a big issue. So we work along with them, we walk along with them through the process, through the CS process, and through all of that process there.
Can you think of anybody in your mind who stands out as a great success story?
We have so many great success stories.
Oh, I'm so glad.
And again, I think the success, it depends on how you view the success for that woman, because every small step for me is a success for that woman that we work with. We have definitely seen a number of women who have completed successfully the program that we offer. They have been in our continuing care for a couple of years, and they are back in school now. They have reunified with their children and raising their children in the best possible way that they can. And we have seen those kids from like birth, and now they are in maybe age 5 or 6. And
so you've broken that cycle.
I think we have helped. We are trying to help and support them wherever they are at. I think the important piece is just to walk with them, hold their hands, and tell them that we do believe in them. If we focus on their strengths rather than focusing on their weaknesses, that makes a huge difference in their lives.
What did you want to add?
And also, if they fall, they can get up. They can get up, and we help them up to go again. Changes does take time, and the process might be slow, but they'll get there step by step, day by day.
Well, they get there thanks to people like you. Thank you so much for being here today.
Yeah.
It's such an important issue. And to know you're there, helping them, holding their hand, it's remarkable. BCCHC.com or jeantweed.com for more information. When we come back, we're getting ready for Valentine's Day with Waistbot. I think there's a little chocolate involved. Yeah.